Tonight we are talking about exhibitionistic disorder, which is one of the paraphilic disorders in the Diagnostic and Statistic manual that we use in sex therapy.
We're going to dive into what exhibitionistic disorder is, some treatment options for it, the risks of it, maybe some examples of what it looks like, theories around why this disorder exists, and how common it is.
Welcome to the Pleasure Program. My name is Holly.
I'm Victoria.
We're two licensed therapists who specialize in sex therapy. We're here to answer your questions, share our knowledge around all things related to a healthy and pleasurable sex life. Just a bit of a trigger warning, we are going to be discussing sexual behavior that can be considered not consensual and illegal in this video. So first, let's talk about what exhibitionistic disorder is.
Exhibitionistic disorder is one of the paraphilic disorders in the DSM, which is the manual that we therapists use to diagnose people with various mental disorders. In general, exhibitionism, it's when you experience sexual gratification from the urge or fantasy or act of being watched, particularly around when you're exposing your genitals or engaging in sexual activity.
There's exhibitionism, which might fall more under a kink behavior, but that behavior also can become a disorder.
Yes.
So let's talk about what would make exhibitionism become exhibitionistic disorder.
First, one of the signs that this is disordered is when it's causing significant distress or impairment to an individual. So this can look like someone having a lot of shame or guilt or anxiety around having this sexual urge or desire, or it could be impairing them, like their functioning, such as they're so interested in it that it's getting in the way legally or in relationships or in employment, etc. Another aspect of this disorder is that it is disordered if this person has acted on this urge on a non-consenting individual. What this means is that someone, maybe they flash someone in public, right? That person didn't consent to be being shown that person's genitals, right? It's not a disorder if you're flashing your genitals to your partner who is consenting in that moment to seeing your genitals.
Right.
Even if the person has not acted on this behavior, if they're fantasizing or having an urge to act on this behavior to a non-consenting person, that is also disordered. And lastly, like this urge occurs over a period of about 6 months. So let's get into some examples of what this looks like, right? And the biggest one that comes to mind is typically flashers, right?
Somebody who's streaking. It seems like a silly and maybe more benign example of this, but that individual might not be engaging in that behavior for any sort of sexual arousal or sexual gratification on their behalf. They might be doing that just to like have the shock factor or to be goofy, or just picturing, people running through
like football stadiums.
Yes, that might not technically meet the criteria for exhibitionistic disorder if there's not a sexual gratification piece for that individual.
Very true. Even though it might sound kind of silly when people are engaging in this kind of behavior, whether it's streaking or whether it's flashing, at least in the US, this is a serious crime. This could lead to someone being arrested or being charged with a felony, which means that they could potentially have to register as a sexual offender or lose their right to vote. This could have some serious consequences.
Another example is when somebody uses hotel rooms as a way to engage in this behavior, meaning they will expose themselves or genitals to, for example, someone who works there, like housekeeping.
And that can also have not only crime consequences for that individual, but also there's consequences of how often are you doing that? How much money are you spending, right? Like the money you're spending, the time, like there's more consequences for individuals with this disorder, even from that sense.
Right, and that can be quite terrifying for the victim that person who doesn't understand what this might mean or what could happen. Am I in danger?
These behaviors that I'm about to mention don't necessarily fall under the particular diagnosis of the disorder, but they are definitely concerning, and so should be mentioned when considering whether or not you have disordered behavior around exhibitionism. One is masturbating in your pants in public, right? Are you exposing your genitals? No. But is that concerning? Yeah, absolutely, right? Again, you're doing something sexual, insinuating exposing of your genitals in some way to non-consenting parties.
Right, and it's still the demonstration and exhibitionism of a sexual behavior, even if your genitals are not exposed.
Something else that's actually considered a different paraphilia is telephone scatophilia, which is when individuals make obscene phone calls. Similar along the lines with exhibitionism, right? Like you're exposing yourself sexually in some sort of way. It's just via the telephone. That's also concerning because this is often done with non-consenting people, right? So this looks a lot like people calling different hotlines, like even the suicide hotline, to make these sort of obscene or threatening sexual kind of conversation.
So if you're asking yourself, do I meet the criteria for exhibitionistic disorder?
The issue here is consent. So if there is any aspect of your sexuality with exhibitionism, whether it's a fantasy or an urge or a behavior that is including non-consenting individuals, that's when a red flag should be going up that you should seek professional help in your area, right? Like we're not a substitute for that.
You need to seek professional support from somebody who specializes in paraphilic disorders. So there are treatment options out there available for people struggling with exhibitionistic disorder. It's just that often people don't seek help until they've entered a legal issue. Usually that's when you've been arrested or it's part of your sentencing or court-ordered treatment to get specialized help in this area. But you don't have to wait until something like that happens. We'd rather you be proactive than reactive. So let's talk about what your treatment options might be here.
Some of the goals of that treatment might look like identification of triggers that cause urges or fantasy or behaviors, plans to avoid these triggers or reduce these triggers.
In treatment, you will be provided psychoeducation around the tools to help control these impulses and find acceptable ways of coping. Increasing and improving your empathy towards others so that you really understand the impact this has on those unsuspecting victims.
Another big piece of therapy might be to help with some cognitive restructuring. So that might look like identifying thoughts and patterns that might lead to engaging in these behaviors and intervening with those thoughts in some way, whether that's challenging them or reframing them or replacing them. And these are just some ideas of what therapy might include for you. So please don't take this and run with it, right? There's a lot more that therapy can add as well that we haven't mentioned. Also paired with therapy, there are sometimes instances where people like to use medication to help. Sometimes medications can do things such as inhibit sexual hormones and reduce overall desire or arousal.
If hypersexuality is a factor here and you need to bring down that level of hyperarousal, then medications can assist with that.
Okay, let's talk about some theories around this disorder, how it comes about. Psychodynamic theory has an interesting perspective around this kind of disorder. So there's a theory that this kind of disorder comes about from seeking reassurance, right? So maybe having some sort of insecurity around your penis or your genitals and seeking that reassurance through exposure, right? Like that shock and that awe might provide some sort of reassurance for the insecurities that you are struggling with. Some people have this intolerable kind of anxiety and then obtaining an excited or a fascinated response affirms that person for them. They might misconstrue shock and fear to excited or fascinated. Along with this theory, it's talked about how the penis is a symbol of masculinity historically, deeply, deeply tied to worth and identity. And so this theory states that some overcompensate their anxiety and insecurity with some narcissism and competitive kind of aggression. And so that leads them to engaging in these types of behaviors. And it's interesting because we have a whole topic on penis size that you should check out.
Mm-hmm. Let's talk about the prevalence of exhibitionistic disorder. Mm-hmm. Victoria, you've been talking a lot about penises. Is there any research that suggests women engage in this behavior?
So, in terms of prevalence, there is no numbers on females right now. The prevalence, even for males, is questioned a little bit. It's about 2 to 4%, but even then, it seems like that's not widely known. We're doing studies based on inmates, essentially, not people who are just disordered that haven't acted on this behavior. So that number, 2 to 4% of males, might be misconstrued, but it's unknown for females. And I've thought a lot about that. I think when you think about women flashing, such as taking their tops off, they might be doing it, some of them, for a shock and awe and enjoy a non-consenting person, but that is for some reason more welcomed and normalized.
Yeah, you bring up a good point. I also wonder too, for women who are flashing their breasts, if they are getting a sense of sexual gratification and arousal, or fantasizing about doing that, or feeling the urge to do that. Those are all important aspects to keep in mind when it comes to exhibitionistic disorder, that there's a sexual arousal. Bless you.
I was trying so hard.
Those are important aspects to keep in mind when considering whether or not this behavior meets the criteria for exhibitionistic disorder. And so if that individual is not getting sexual arousal, plus breasts are not genitals. That's the other thing that seems to be the exposure of genitalia is what is part of the criteria for this disorder, or the urge to expose your genitals, or the fantasy of doing so with non-consenting individuals. It gets complicated. You got to wonder if women are exposing their breasts, that they're doing that for other reasons, such as to arouse other people, or for that maybe they're trying to get that reassurance and that gratification that they have something to show. So another theory as to the development of exhibitionistic disorder would be from the behaviorists. Their theory is that there's conditioning involved in the development of this behavior, meaning you would be pairing the exposure of genitals with something that is also sexually arousing or gratifying. And those two variables kind of become fused in your brain, and therefore there's that association that's been developed.
There's also the behavioral learning model, which suggests that there's potential that this disorder has come about through learning. Like this behavior has been modeled to them in some way, or they've observed this behavior or been victims of this behavior, and that has led to some sort of imitation.
Another theory is called the compensation model, meaning that individuals who engage in exhibitionistic behavior are seeking to compensate for a lack of having a sexual outlet or sexual contact in another way. It's important to really think about the consequences of this behavior and those risks, the consequences for the individual engaging in this behavior, and also consequences for the people witnessing, non-consenting.
This disorder is really serious.
I also think that the impact that this behavior has on victims is really minimized. Like this, well, I didn't touch this person, or, you know, it was just, what harm could there have been done?
Being a victim of someone suffering with this disorder can lead to long-term distress and post-traumatic stress disorder. So this just adds to the importance of, if you're struggling with this, you know, seeking that professional help for you and for those other people that you could potentially cause harm to. And another big disclaimer, we don't want anyone to misconstrue that we're shaming kink. There's a huge difference between exhibitionistic disorder and just being kinky with exhibitionism. And we're going to have a whole nother video on what that kink looks like, but we figured we'd start with the disorder because it's so serious.